So let us begin with the next topic, that is the clavipectoral fascia and the intermuscular scapular spaces. We will see this topic in three-dimensional rotation model so that we understand the structures better and remember it for a very long time. So the first topic, that is the clavipectoral fascia. Now it's a fascia. So where is it? That is the most important point. So this fascia lies deep to the pectoralis major muscle. That is an important MCQ also. It lies deep to the pectoralis major. Let me show you this fascia first. So this is the pectoralis major muscle, which we are all aware of, right? Let me add the connective tissue. So if we just have a look in this area, you can see this is the pectoral fascia. This is not the clavipectoral. This is the pectoral fascia, which is above the pectoralis major muscle. I have now hidden it. Now you can see the pectoralis major muscle. Now if I even hide or remove this, now you can see the structure. I hope you remember from the previous discussion. From beneath the pectoralis major, we had the muscle, that is the pectoralis minor muscle, right? So this fascia, which is lying just underneath the pectoralis major muscle, this is the clavipectoral fascia. Okay, so now see very carefully. Let me remove this platysma from the view. Okay, so you can see this is the clavipectoral fascia. Now let me isolate and show you the beautiful clavipectoral fascia. You can see this is lying in the pectoral region, just below the clavicle. Okay, so now you can see it is also having an attachment to the coracoid process of scapula. Can you visualize that also? The C-shaped process. So it is attached to the coracoid process of scapula, very important. Another thing, if you can see, there is a hole, there is a space through which the structures will be passing. So this is very important. There are certain structures which are piercing the clavipectoral fascia, which we will talk about in a while. So let me show you these structures first. Arteries, veins, lymphatics and nerves. Okay, so these are the structures which are filling this gap, which you can see, that is the clavipectoral fascia, which you can visualize, right? So this gap is allowing the passage of a vein, a nerve, artery and a lymphatic. So let me see what are these. So number one, the superior attachment, that is the clavicle, which we saw in 3D. Medially, there is also something, that is the first rib and the costoclavicular ligament. Okay, so then inferiorly we have, it forms the suspensory ligament of the axilla, and laterally I showed you, that is the coracoid process of scapula. So we know the attachments of this fascia, the location of this fascia. What are the muscles which are enclosed? That is the subclavius and the pectoralis minor. So you could see that also. Sorry, you could see this just beneath the clavipectoral fascia. We can very well see the pectoralis minor muscle, which we could analyze, okay, from the previous discussions. Okay, so now the key important area which you have to remember. Let me highlight this. This is the most important area to remember, the structures piercing the clavipectoral fascia. Okay, so what are these? Number one, that is the lateral pectoral nerve, cephalic vein, thoracoacromial trunk, that is the artery, and lymphatic. I will show you in 3D, don't worry. First see an image also for a better understanding. So this is a section which is taken okay, just to represent the same. So if we take a sagittal section, okay, so in that you can visualize these structures in this manner. So on the top we will have the clavicle cut section. Okay, here will be the pectoralis minor muscle. Above it, or I can say superficial to it, will be the pectoralis major muscle. Okay, Just below the clavicle you will have the subclavius muscle, okay. And similarly, so this is a schematic just for understanding. So axillary vein, axillary nerve, axillary vein, axillary artery, all these structures will be coming within the axillary sheath along with the lateral cord. So here what is important is the structures which are piercing and moving outside through the clavipectoral fascia. So number one question, why they need to traverse? That way you will remember the structures better. So number one, see, lateral pectoral nerve is the supplying nerve for the pectoralis major. So to supply the major, it has to come outside, so it will pierce, okay. Similarly, thoracoacromial trunk artery, which is the arterial supply, again it has to give off certain branches, we have already discussed, so that will also pierce. Then there will be the vein, that is cephalic vein, which we will talk about in a while. That is, the cephalic vein is present on the lateral aspect compared to the basilic vein, which is on the medial aspect. The mid joining vein at this cubital fossa, that is the median cubital vein, which is taken for sampling. So this structures piercing is vein, nerve, artery and lymphatics. So vein is cephalic vein, nerve is lateral pectoral nerve, thoracoacromial trunk is the artery and lymph vessels, okay. So you can see this, visualize this on 3D. This vein is very important, this is the cephalic vein. Okay, just see this cephalic vein, how it is oriented. It is present laterally in the arm region where it is commonly asked, okay, and it lies in the deltopectoral groove, okay. So this is the deltoid muscle, this is the fascia, just beneath it there is the deltoid muscle, okay. And I can show you on the opposite side, let me not disturb that side. So you know this pectoral fascia, pectoralis muscle, okay. So this is the deltoid muscle, this is the pectoralis major. So between the two there is the deltopectoral groove in which the cephalic vein is present. That's how you will identify it on any specimen images. So you can see it's running laterally in the arm region, okay. And if you see the vein on the medial aspect of the arm, this one, this is the basilic vein, okay. If I isolate just the basilic vein, okay, so they both are communicating with each other with the help of the median cubital vein. This is the median cubital vein, which we'll talk about in the cubital fossa, okay. So just remember these things, okay, very, very important. So coming back to the clavipectoral fascia, you can see the cephalic vein which is piercing this aperture or the hole, okay. What else? You can see this nerve, this is the lateral pectoral nerve which is just coming out and it has to supply the pectoralis major muscle, okay. Then vein we have done, the nerve we have done. What is the artery? So now let me show you this artery. This is the thoracoacromial artery, the same one which we discussed in the axillary artery branches. So this also has to come outside from the clavipectoral fascia and then give off its 4 branches which we have discussed. So artery, vein and nerve. Then what else? The lymphatics. So there will be lymph vessels, okay, the axillary lymph vessels which will be coming out of this region, so out of this fascia to drain, okay. So that also is important. So we have all the 4 important things in the body which are present in the clavipectoral fascia, structures piercing it. Okay, then we move on to the next, that is, after this clavipectoral fascia, let me take you to the intermuscular spaces. Now these are again very interesting and easy again. So intermuscular, first catch the word intermuscular, so between the muscles. So what are the muscles involved? So we have quadrangular muscle, quadrangular intermuscular space, upper triangular space and lower triangular space, okay. So if you do your index finger and the third digit, okay, in this manner and place another overlapping in this manner, so maybe you can see here. So this is the position of the spaces, okay. So one which is formed here in the center, this one is the quadrangular space. here is the upper triangular and then here is the lower triangular space. So this is the exact picture which you will get on the real cadaver. Now your job is to understand what are the boundaries. Okay, so let me show you. See this same manner picture which I just showed you. Okay, so you can see 2 fingers here and then 2 fingers here. Okay, that is how we made this. So this is the quadrangular space, this is a triangular space, upper one, and this would be the lower triangular space. Now see the boundaries and its contents, which is most important. Okay, so let me keep the image and the boundaries contents side by side so that you can visualize better. Okay. So in this image what you can see is the teres minor, teres major muscle. This is the triceps brachii, specifically the long head of triceps brachii, and you have the humerus bone. So just understand the quadrangular space boundaries first. So these 4 boundaries, what would be these? Teres minor, check. Okay, teres minor along with subscapularis and capsule of shoulder joint. Then you have teres major, so minor above, major below. Okay, just remember this simple thing, don't forget. Minor, rhomboides minor above, rhomboides major below. So minor is above, major is below. Just remember, just for understanding, major heavy muscle, as I told you. Okay, bulky muscle, previously also I told you this. So this will be lower. So teres minor, teres major will be the boundaries for the upper and lower boundaries for the quadrangular space. And on the side, this will be the long head of biceps, triceps, and on the other side, on the lateral aspect, you will have the humerus. So these boundaries are very easy and sorted. Then talking about this upper triangular space, in this the upper boundary, superior boundary is teres minor, lower boundary is the teres major or inferior boundary. And now see laterally, see medially we have the apex only, so laterally we have a boundary which is formed by the long head of the triceps brachii. So this this covers the upper triangular space. Now the lower triangular space, I think it is quite easy again. So we have same boundary, teres major, not minor. Now please remember, the teres minor is not participating in any boundary of lower triangular space, and that's what they ask you to test you. Okay. So teres major, this is the long head of triceps, and here you have the humerus. So this triangular space is the lower triangular. Now structures inside them or content is very easy again. See, in the neck region, this is the humerus neck region. So in the neck you will read that you have a nerve, that is the axillary nerve, which is related to the surgical neck of humerus. That's also a separate question. Then if I zoom in, okay, so in this region you have the axillary nerve and the artery. Which is this artery? Very important again. Suppose this was the humerus, so anteriorly you had the anterior circumflex humeral, posterior, we are looking from the posterior side, right? You can see the spine of the scapula. So we are looking at this artery, that is the posterior circumflex humeral artery. Okay, so these two structures are very easy to understand and remember. Then lower triangular space, this is corresponding, or I can say very close to the radial groove. So in the radial groove, if you are aware, the structures, that is the nerve is the radial nerve only. Okay, that is sorted. What is the vessel? Now there is a deep branch of the brachial artery in the arm, and that is profunda brachii artery. Okay, so quadrangular and lower triangular are the most important content wise. If you look at the upper triangular space, there is only one content, not very frequently asked, that is a circumflex scapular artery. There is no nerve as such in this area. So let me show you this in 3D so that you remember better. Okay, let me just bring the arteries, nerves and muscles. Okay, so now have a look. So I hope you are getting an orientation where we are looking at. We are looking at the back region. So this is a scapula bone. Okay, so we are looking at this region. So these are the triangular and quadrangular spaces in this area. Now there is a muscle which is removed in the schematic representation, that was deltoid. So I am removing the deltoid muscle. Now you can see these spaces better. Okay, don't confuse with this one. I am removing this branch. Now see, can you visualize the same structures? Let me show you the muscles. So this is the teres minor. Okay, teres minor. Then you have the teres major muscle below. Okay, similarly like you had the rhomboideus, if you remember, right? Rhomboideus minor and rhomboideus major. Okay, similar manner, but here you have teres minor and teres major. Then on the side, this is the triceps, specifically long head of triceps, that also I have shown you previously in 3D orientation. So, and also this is the humerus bone. Now you can see the axillary nerve. This is the axillary nerve which is present in this quadrangular space. That's where you will find it in the real-time dissection also, images also. This winding around artery, this is the posterior circumflex humeral artery. So these are the artery and the nerve. Look at the lower triangular space. In this lower triangular space, let me show you here this region. This is the deep brachial artery or the profunda brachial artery. Nerve, which one? That is the radial nerve which is running in the radial groove. Okay, so one is left, that is the upper triangular space. So now you can see all these three spaces in this orientation. Let me zoom into the upper triangular. You can see only one artery, that is the circumflex scapular artery. So these are the different structures which are seen in the various intermuscular scapular spaces. It's very easy topic, but you just have to remember it in 3D in your mind so that you can visualize the boundaries and the contents. It's not a very difficult topic. Okay, so that's what we have discussed. Okay, then we move on to the next topic, that is the axilla and its contents.